Gentlewoman from Richmond City, Ms. McClellan.
Thank you, Mr. Speaker. I rise for a point of personal privilege and a motion and an introduction, but they're all in one thing.
Gentleman has the floor.
Thank you, Mr. Speaker. You've probably noticed that I'm wearing a red ribbon today, and that's because today is AIDS Awareness Day, where advocates and staff from Virginia organizations responding to AIDS, the Fan-Free Clinic, Patient Services Incorporated, have been going around to our offices carrying red folders and telling personal stories of living with HIV and AIDS. We have some here seated in the chamber, some in the gallery, and in rooms watching today. 30 years ago, a diagnosis of AIDS was a death sentence. We've come a long way since then, and developments in research, medication, prevention programs, and education have turned what was certainly a deadly disease into a chronic disease. People who take HIV medications are living long and productive lives. We've come a long way in 30 years. We now talk more easily about HIV and AIDS. We educate our children about it. We know that AIDS is 100% preventable. But according to the Virginia Department of Health, 23,000 Virginians are living with HIV today. Every state, including Virginia, has an AIDS drug assistance program that is funded with both state and federal dollars. And while the disease is still growing, our funding is not. The medications that people living with HIV must have to live are very expensive. And for some, it's impossible to obtain without ADAP. Since this past November, Virginia is one of 11 states with a waiting list for these drugs. Over 760 people are facing the fate of disenrollment because we are running out of money. Governor McDonald has recognized that ADAP is a core function of state and public health services, and he's added $3.6 million in fiscal year 11 and 12 to increase ADAP capacity to serve. But more will be needed next year. And so JCHC has introduced a budget amendment to add $6.4 million more next year. This funding is critical to the well-being of Virginians living with HIV and the treatment and prevention. I ask you, when you get back to your office, to look through the materials that have been left in the red folders. Listen to the personal stories that they tell, and know this is a preventable disease if we do our part. Each year, there are 1,200 new cases of HIV. And our advocates that are here today are doing what they can to remind us there's more work to be done. One such advocate who came every year recently passed away, leaving behind a partner, Joe Price, sisters Brooke, Barbara, and Amy, brothers, nieces, nephews. His name was Laird. He was an advocate for the Richmond gay community, and before that, the Chicago gay and lesbian community. He was inducted into the Chicago Gay and Lesbian Hall of Fame, recognized by Mayor Daley for his tremendous leadership. Here in Richmond, he was Director of Social Services at the Fan-Free Clinic. In the words of their executive director, he will be remembered for his commitment to social justice and to all that he touched, and through the Fan-Free Clinic's long-standing commitment to prevent the spread of HIV, compassionately serving those who suffer from it, and advocating for all personally affected by it. He was just one of many that we have lost over the years to this disease. And therefore, Mr. Speaker, I move that when the House adjourn today, we adjourn in the honor of those Virginians currently living with HIV and AIDS, and in the memory of those who lost their battle with this dreaded disease. Thank you.